What is arteriosclerosis, atherosclerosis? Arteriosclerosis and atherosclerosis involves the buildup of deposits on the insides of the artery walls. This condition causes thickening and hardening of the arteries. In arteriosclerosis, the deposits are composed largely of calcium. In atherosclerosis, the deposits consist of fatty substances, and artery walls lose elasticity and harden. Both conditions have about the same effect on circulation, causing high blood pressure. This ultimately leads to angina, chest pain brought on by exertion, heart attack, stroke, and/or sudden cardiac death. Although arteriosclerosis causes high blood pressure can also cause arteriosclerosis. Calcium-based and fatty deposits typically form in areas of the arteries weakened by high blood pressure or strain. The consequent narrowing of the arteries then makes blood pressure even higher. As the arteries become less pliable and less permeable, cells may experience ischemia, oxygen starvation, due to insufficient circulation. The fatty plaques can be either stable or unstable. Unstable plaque allows particles to break away and cause further blockage downstream in the smaller vessels. This makes it a more immediate clinical importance. If one of the coronary arteries becomes obstructed by accumulated deposits or by a blood clot that has either formed or snagged on the deposit, the heart muscle will be starved for oxygen and the individual will suffer a heart attack, also referred to as a myocardial infarction, MI, or a coronary occlusion, a coronary. Older adults are at a greater risk for this kind of heart trouble. When arteriosclerosis occludes the arterial supply of blood to the brain, a cerebrovascular accident or stroke occurs. Most of those affected have at least one of the major risk factors for atherosclerosis: smoking, family history, hypertension, diabetes, abnormal cholesterol levels. Peripheral atherosclerosis, also called arteriosclerosis obliterans, is a type of peripheral vascular disease in which the lower limbs are affected. In early stages, the major arteries carrying blood to the legs and feet become narrowed by fatty deposits. Atherosclerosis of the leg or foot can not only limit a person's mobility, but can also lead to loss of a limb. People who have diseased arteries in the leg or foot are likely to also have them elsewhere, mainly in the heart and brain. Early signs are aching muscles, fatigue, cramping pain in the ankles and legs. There may also be pain in the hips and thighs. Additional symptoms include numbness, weakness, heavy feeling in the legs. To see if you have this, there is a peripheral artery function self-test you can do yourself. This simple test can determine how well your blood flows through the arteries of your legs. There are 3 areas on the lower leg where a pulsating artery can be felt by lightly touching the skin covering the artery. One spot is the top of the foot. Second spot is the inner aspect of the ankle. Third spot is behind the knee. Apply pressure lightly to the skin on these spots. If you cannot find a pulse, this is an indication that the arteries supplying the leg may be narrowed. Consider consulting your healthcare provider. Special studies may be needed. The following herbs are helpful if you suffer from arteriosclerosis: cayenne, capsicum, chickweed, hawthorn berries. Ginkgo biloba can improve circulation, but do not take if you have a bleeding disorder or are scheduled for surgery or a dental procedure. Green tea lowers cholesterol and lipid levels, thus decreasing chances of atherosclerosis. Green tea contains vitamin K, which can make anticoagulant medications less effective. Food recommendations are eating high-fiber foods, eat foods rich in vitamin E to improve circulation, and maintain a healthy weight for your height. Obesity causes unfavorable changes in serum lipoprotein levels. Remember to consult your healthcare professional before self-treating your condition.